Hi friends, today we will be discussing about salivary gland. Salivary gland secretions of these glands help to keep the mouth moist. It provides a protective and lubricant coat of mucus. Then we will be discussing about classification of salivary gland. First, based on the presence or absence of duct. First one is major salivary gland. Under that, secretion into the oral cavity through a duct. Major salivary gland. First, parotid gland. Second, submaxillary gland. Third, sublingual gland. Then we will be discussing about duct of major salivary gland. First, parotid gland have Stenson duct. Submaxillary gland have Watson duct. Sublingual gland have duct of Ranvinus. This is a diagram showing glands and duct. Second classification is based on the type of cell. First, serous gland. Its glands are predominantly made up of serous cell. It secretes thin and watery saliva. Examples of serous gland are parotid and lingual gland. Then next is mucus gland. It is made up of mucus cell. It secretes thick viscous saliva with high mucin content. Example of mucus gland are lingual gland and buccal gland, along with palatal gland. Then mixed gland. It is made up of both serous and mucus cell. Example of these are submandibular gland, sublingual gland, and few labial gland are mixed gland. This is a diagram showing various glands along with their ducts. This is a diagram showing salivary gland along with their ducts. Then we will be discussing about parotid gland. It comes from two words, para that is near and otis that is ear. The gland wedged between mandible and sternocleidomastoid muscles. To facilitate mastication and swallowing and to begin digestion of starches. Structure of parotid gland. The parotid gland duct are 5 cm long, 5 mm in diameter. Its surface superficially and lateral, superior and anteromedial, posteromedial, then its border, anterior, medial and poatrial, then its ends, superior end and inferior end. Then we will be discussing about atrial and blood supply of the parotid gland. Atrial supply supplied by branches of external carotid artery. Nerve supply. Great auricle and oroculotemporal nerve. The next is submandibular gland. This is a large salivary gland, J-shaped, it is situated along the body of mandible. The duct, Watson duct, which about 5 mm long, opens on the floor of the mouth. The next is sublingual salivary gland. This is the smallest of 3 major salivary glands. The gland lies below the mucosa of the floor of the mouth. About 15 ducts emerge from the gland. Weight is about 3 to 4 grams. Then minor salivary gland. There are about 450 minor glands in oral cavity, situated mucosa, lips, cheeks, palate floor of the mouth, and retromolar region. The highest number, that is about 250 of minor salivary gland, is situated in the hard palate. These are some important points. Mumps is an infectious disease caused by mumps virus, which affected the parotid gland. Second, parotidectomy is the surgical removal of parotid gland Tuberculosis and syphilis can cause granuloma formation in the parotid gland. Thank you, friends.